Dr. Money as a person is a trailblazer. She epitomizes certainly everything I think about when I think about championing women's health research, women's health advocacy. She's passionate, determined, hardworking, brilliant, collaborative, friendly, funny, and a leader. Probably an understatement would be to say that she's had a profound impact on women's health.
Dr. Money is innovative, curious, courageous, conscientious. She's really been quite a pioneer in many ways.
She went down to the United States. She did a fellowship as a Canadian when that was a thing that wasn't done. She was there at the very beginning of the AIDS epidemic, the very, very beginning, receiving those faxes off a printer about how we can change the outcome for women living with HIV in pregnancy and ensuring that their babies don't get HIV. She did her training and then she came to Canada and she took all of that knowledge and she basically built how we care for women living with HIV in pregnancy here in BC, but as well as nationally. A lot of the things that we take for granted in terms of how we care for people, Deb wrote. Deb was the beginning of. Now, she did it with a great group of collaborators, but if you look back and you look through all those things, there's a very common thread, and that is Dr. Money's name on those things. And she really kind of pushed our specialty forward, and as such has had a massive national and global impact, and really is the reason that Canada is on the scene as far as reproductive infectious diseases goes.
She understands women's health. She understands the drivers. She has been quite fierce, I'd say, in terms of really supporting and obtaining research funding.
She's a model in terms of clinical expertise. She is, one of the top people to go to in terms of clinical care. She's a great thinker, tremendous and ethical and principled researcher, and also at the end of the day puts patients first and really wants to answer the questions to make women's lives better.
Foundationally, as a champion, she's also an advocate for women and others themselves, particularly marginalized women. I think on so many levels, she's really significantly moved the dial on our understanding of women so that they can live in a more healthy way.
Her entire career has been about advancing and improving women's health. One of the key ways she's done that is by starting the Women's Health Research Institute here at BC Women's Hospital and at PHSA. Women's Health Research Institute is an entity that brings together women's health researchers in the province. And by creating that entity, she's helped to elevate the conversation around women's health research. She's helped to improve the funding we get for women's health research. And she's trained the next generation of women's health researchers. And by starting that entity, she really put women's health research on the map here in British Columbia and across Canada.
Congratulations, Deborah. We go a very long way. I am proud of you. Would you ever thought that you would get this marvelous award? I wish you all the best and success from here on.
I really can't think of anyone more deserving of being called a women's health champion in Canada and beyond. She was the first person in Canada who pursued infectious disease training after being an OBGYN, and I was the second. And there have been a long line of people after both of us, and she's really been sort of the guiding light and inspiration for all of us across the country. She's been an incredible mentor and friend to me for all of these years, and I truly value our relationship. Deb, congratulations. You really are a champion, not just of women's health, but in general, a champion. And I'm so happy for you and proud of you.
Where I really understand the deep impact that Dr. Money has had on women's health, research, policy, practice, is when I go to international meetings with her. When I walk into a room and she is called out as the Canadian in the field. And she is the reason that our subspecialty exists in Canada. But her advocacy, her policy work, her research over the years You don't really understand it until you step onto a national or an international scene, and everybody knows Dr. Money, and everybody knows the work she did, and everybody has a deep respect for the work that she has done. And that's when I really began to understand the impact that Dr. Money has had on women's health and women's health overall across the globe.